Women's health care and reproductive rights were again a concern in the last legislative session. Sam Robles, Advocacy Director at Progress, Texas, tells us that progressives were able to stop some harmful bills from being passed while also working towards some bipartisan bills that improved health care for women in Texas.
What we're going to be seeing going into effect on September 1st are a slate of reproductive health care bills that are focused on making sure that women who are incarcerated are getting equitable health care. And what we've been seeing, and part of the work that we've been doing as Progress Texas and with additional reproductive advocates across the state, is finding ways to push for legislation that speaks to the lives of Texans, from birth control to making really hard decisions for families when it's pregnancy or maybe end-of-life directives. And so what we've seen this year is an effort on both sides of the chamber, bipartisan, that is moving towards increasing the level of health care that women are receiving while incarcerated. We're also seeing protections for sexual assault survivors. And the state is now going to be tackling on how to study and really address postpartum depression for women in Texas.
Now, so House Bill 650 makes a series of changes to state law that are designed to make state prisons more accommodating to female inmates in regards to their health care. The bill bans the shackling of pregnant women during childbirth. And so that was a problem. It had been happening, and it was recognized and addressed in a bilateral way in the last legislative session. You see this as moving things in the right direction?
That's right. We're moving things in the right direction for Texas women, and in a way where each of us needs to access reproductive health care, and that comes at different parts in our lives, right? And the way we access it should not depend on our zip code or our immigration status, or if we're incarcerated or not. And so when we look at the anti-shackling efforts that have been underway by Representative Celia Israel and Republican Representative James White, I mean, this is what dignity looks like for women and reproductive health care here in Texas.
Now, also HB 253, that's the health care access for postpartum depression, but it also has been talked about as this 5-year study. We'll be looking at hopefully trying to figure out why we have such high maternal mortality in Texas. And this is a major concern.
That's right. In Texas, we are seeing high rates of maternal mortality, and we see it in regards to Black women. And so there are a number of things that happen after pregnancy and leading up to pregnancy that we are not catching in our system, and that is leading to the deaths of mothers that should not be happening. And so as we look at maternal mortality and efforts to address postpartum depression, really what we're doing and what the state is responsible for is making sure that women who go through with pregnancy are able to come out of it and raise their families, and that we're making sure that there are no sort of racial bias, discrepancies that are happening along the process.
So women having a safe birth experience, post-birth experience, reducing Texas maternal mortality, infant mortality, that should be something that everyone in Texas should agree that needs to be a priority. Every woman in Texas needs to have total confidence that they're going to have a safe birth experience.
That is right. Every single woman in Texas should be able to plan for their families, to go through the experience, have all the resources and support that they need to deliver, and to create and to raise a family that's going to thrive here in Texas without having to worry about, will I be able to go to the doctor next month after my Medicaid ends? These aren't the sort of decisions that should be weighing down on women.
But there were other bills that are still, some people thought, made things difficult for agencies like Planned Parenthood. Senate Bill 22 goes into effect on September 1st, prohibits government entities from providing anything of value to an abortion clinic or an affiliate, even if money isn't explicitly for abortions or the clinic doesn't perform the procedure. Proponents of the law say it's an effort to protect taxpayers' funds from going to entities associated with abortions. And so people see this as actually hurting overall health care for women.
That's right. And while the state of Texas has made significant gains in making sure that women who are incarcerated, or that we're making sure that we're addressing postpartum depression and maternal mortality, what we've seen this year is that the state of Texas has defunded local health care in a state where Texans do not have access to it, where we have the highest rate of children not being insured in Texas. And so this is really, for the communities that are being served by Planned Parenthood and others across the state, these are clinics that they can access that are just down the street from where they live, right? And these are clinics that they have been in those neighborhoods for so long, catering to the low-income Black and brown women across the state. And I think that's a really, it really shows where the state's priorities are when we're defunding local health care but not making the gains to make sure that every single Texan has access to it.
Now, when a lot of these bills are passed and they become law, people need to know that that's now the law and what their rights are. And we need to promote this new law. It's the right to pump breast milk. Starting Sunday, Texas law makes it clear that women can pump breast milk wherever they want. The previous law allowed breastfeeding wherever, but didn't specify pumping. We all know that breast milk is the best option for children to have a healthy first year of life. So, so this is, I would say this is something that we need to let people need to know so they can stand up for themselves.
Absolutely. And the right to be able to pump breast milk is such an important family right, and I think really falls a line in protecting pregnant women and women who have families. We know that they're along the different parts of the hiring process or promotions, or even in the workplace, we see discrimination happening against mothers for all sorts of reasons. And for a woman to be able to raise her family and go to work and be able to not only perform in her job, but be able to provide the best sort of health for their baby is so important. And this is one that I think really shows where workplace justice has come a long way in coming together with reproductive health care.
And everyone should be an advocate for these reforms.
Absolutely. And I think what we're seeing happening in the state legislature is sort of a new turn. We have been under a state that has for a long time come out with a lot of anti-abortion, anti-women initiatives. And what we are seeing happening across the state following the abortion bans is that support for abortion access is only increasing. And a majority of Americans and Texans support access to abortion. And what we are hoping to see and what we will see is that abortion is going to become a key issue for voters in 2020. And we're going to start seeing the demographics and the ideologies of those that represent us in the Capitol change. And along with that change is going to come proactive legislation that really looks to repair the damage that has been done to our reproductive health care system.
Sam Robles is the Advocacy Director at Progress Texas.